Today we are going to discuss oral motor feeding. So what is oral motor feeding? Let's start with what oral motor development is. Oral motor development refers to the use and function of the lips, tongue, jaw, teeth, and both the hard and soft palates. So if you run your tongue along the roof of your mouth, you can feel both the hard and soft palates. The development, movement, and coordination of these structures is critical not only for, of course, speech production, but also for safe swallowing and the consumption of various food textures. So oral motor feeding basically is feeding using the oral motor structures listed above. You might be asking, so at what age should a child be able to feed him or herself? Interestingly, before a baby is born, they have begun to develop sucking and suckling reflexes. These reflexes make it possible for a baby to immediately breast or bottle feed just after birth. Today, we are just going to focus on various feeding milestones within the age range of children that attend EduCare and therefore might be in your classrooms. So, in the infant realm, for an infant that is 6 to 9 months of age, they should be able to hold the bottle independently, clean the spoon with his or her upper lip, and eat pureed meats and a variety of pureed baby foods. And then as the baby grows and progresses, at 9 to 12 months of age, we would expect that the baby demonstrates lip closure when swallowing liquids and soft solids, meaning that after they consume the liquid or solid, they are fully able to close their lips, and thus no food or liquid is escaping out of their lips. The baby has begun to self-feed using his or her fingers to grab small foods, such as Cheerios, and the baby begins to drink from a sippy cup and may begin to attempt drinking through a straw. So from the baby's first birthday through 18 months of age, we would expect that the now toddler can coordinate sucking, swallowing, and breathing patterns for longer sequences, can begin to eat finely chopped table foods using their fingers, can bite through crunchy foods like a cracker or a cookie or a goldfish, can move from one, and they can also move food from one side of their mouth to the other while chewing. From 18 months to age 2, we would expect that the toddler can feed themselves with a spoon, although they may still need assistance holding the spoon properly, getting all of the food on the spoon, getting the spoon from their bowl to their mouth, etc. From 2 to 3 years of age, we would now expect that the child can of course consume a variety of liquids and solids, that they can consume liquids through straws and open mouth cups, that they use a spoon independently to self-feed, and at this point in development, they're moving through the process of fine-tuning their feeding skills to make feeding a very functional and timely process. Then, from ages 3 to 5, we would expect that the child can chew and swallow all textures of foods, can use both a fork and spoon to eat solid foods, and can consume liquids in any way that they choose, through straws or open mouth cups, etc. Okay, so now we are going to talk about red flags, or what you should be looking for that may indicate a child has some oral motor feeding difficulties. Some things you should be looking for include arching or stiffening of the body during feeding, irritability or lack of alertness during feeding, food and or liquid escaping through the lips, refusal of food or liquid, a failure to accept different textures, so this might be a child that will only eat crunchy foods, long and exhaustive feeding times, coughing and or gagging during or after feeding, vomiting, An abnormal voice quality, or a voice quality that might sound hoarse or gurgly or breathy, and less than normal weight gain or growth. So, why is this important? Well, a feeding or swallowing disorder can result in, of course, poor nutrition and dehydration, but it can also result in aspiration, which occurs when food and or liquid enters the airway. It can result in pneumonia or repeated upper respiratory infections that can cause chronic lung disease. And importantly, a feeding or swallowing disorder can result in embarrassment or isolation in social situations involving or revolving around eating. All right, so if there is a child that you are worried may have some feeding difficulties, what do you do? Of course, you should first discuss your concerns with the parents and possibly discuss if a pediatrician has been involved, refer to their case history, etc. Then, if it deemed appropriate, you should refer them to a speech and language pathologist. The speech and language pathologist can conduct a feeding evaluation. Remember to be culturally sensitive as feeding practices and norms vary between cultures. Some children don't eat at the beginning of meals because of cultural differences. Some eat all at the beginning, some don't use spoons, etc. So make yourself as knowledgeable as possible about the different cultural variations before meeting with the parents and coming to them with this concern. More information about oral motor feeding can be found on both the ASHA and Feeding Matters websites.